Good morning. On behalf of the organizing committee, I welcome all the dignitaries and the delegates to the National CME in Addiction Psychiatry organized by the Drug De-Addiction and Treatment Center, Department of Psychiatry, PGIMER, Chandigarh. To begin with, I feel honored to invite Professor Jagat Ram, our Director, PGIMER, Chandigarh, on the dais. Professor Jagat Ram is a renowned ophthalmologist of international fame, an ace clinician and researcher, academician and administrator, all packed in one. Sir, we are grateful that you have been kind enough to take out some of your most valuable time for this occasion. I request a flower bouquet to be presented to Professor Jagat Ram, please. I was supposed to invite Professor Ajit Awasthi, but I think. But can we have a bouquet for sir, please?
I'm the part of it.
Okay. As we begin our quest for knowledge, let us seek the blessings of Ma Saraswati, the goddess of knowledge, wisdom, and learning. Now I invite Professor Ajit Awasthi, the organizing chairperson of today's academic program and Professor and Head Department of Psychiatry, PGI Chandigarh, to please welcome the dignitaries and deliver his welcome note. Sir.
A very good morning. Thank you, Professor Basu. I feel honored to welcome the presence of Professor Jagat Ram, an eminent and ace ophthalmologist who is the director of this institute. I am delighted to welcome Professor Rajesh Kumar, Dean Academics, Professor Arvind Rajvanshi, Dean Research, my very esteemed teachers and seniors who are there in the audience, and we are blessed by their presence. Professor Permanand Kulhara, Professor R. Srinivas Murthy, Professor Dwarka Prasad ji, and I'm also very happy to see some of the very senior psychiatrists with us. Professor Kuldeep Sharma, Colonel Rajendra Singh, Dr. N.K. Sharma. They're very senior psychiatrists who are here. It's indeed a great pleasure to see some of my faculty colleagues from other departments in the Institute who are gracing this occasion. And above all, including the principal of 9, our SHE. And, but I think the greatest joy is seeing among us the young delegates who are either young psychiatrists or psychiatry trainees, and they have come from as far as places as the Lakshadweep, Andaman and Nicobar, Sikkim, Maharashtra, Rajasthan, Uttarakhand, UP, Telangana, Andhra Pradesh, Gujarat, and of course, nearer home, J&K, Himachal Pradesh, Punjab, Haryana, and Chandigarh. Sir, tomorrow is the 55th Foundation Day of the Department of Psychiatry. We are a bit in a solemn mood because we have lost recently the founder of the department, my esteemed teacher, guide and mentor, Professor Narendranath Vig, whom we just lost a couple of months ago. And I wish we had him here with us on this occasion as well as tomorrow when we will be having a very kindly instituted oration in his name, which was decided way back in the month of May of this year, the Professor and Inauguration, but we lost him in the month of July. We have a tradition of having CMEs for the last about 2.5 years, which we are targeting on young psychiatrists and trainee psychiatrists on a variety of subjects like intellectual disabilities, learning disorders, ADHD, dual diagnosis. And only last year, we held a CME on the same day of the year. And that was what should a psychiatrist know with regard to the medical complications which are so very common with patients who present with substance use disorders. We had a wonderful CME with the collaboration of the departments of hepatology, neurology, internal medicine, and we discussed a host of issues, including myopathies and the presence of hypertension, diabetes, and so on and so forth. The response was immense. Actually, we have kept a cap on the number of delegates that we can, participants that we can handle. We don't want this to become a rather unwieldy affair. So we have kept a cap on it. This time, seeing the response to our call again, and that was, what else should a psychiatrist know with regard to the medical complications in the patients of substance use disorders? The response was so overwhelming last time that we had to almost double the number of seats available with us for this CME. And we had to shift from a smaller hall to a larger hall to accomplish the objective. This time we will be talking about a host of issues again. Largely those will be about the hepatitis B, the chronic obstructive pulmonary diseases, pain and addiction, and so on and so forth. But the format as we have evolved in our CMEs, these are not only just pure didactic lectures, but these are also, we supplement those with, in a workshop mode, on case witness discussions and some tasks which are given to the participants to carry out, so that they not only have the knowledge base, but also the practical skills in order to deal with such issues. I have just seen Dr. Rajiv Gupta, my school time friend, my contemporary in PGI at the time of doing our MD, and he's a very eminent psychiatrist in Ludhiana. Welcome to you, sir. I'm sure the delegates will get some joy out of their participation in this one-day deliberation. And lastly, I would like to thank my faculty colleagues as well as all the other members of the department for their unstinting support and commitment to these educational activities of the department. Thank you very much.
Thank you, sir. Now is the time for the ceremonial lamp lighting. May I request the team to come up, please, and Professor Jagatram to please. Thank you very much. I now invite Professor Jagatram, the Director of the Institute and our Chief Guest today, to please address the audience.
Professor Rajesh Kumar, Dean PGI, Professor Arvind Rajvanshi, Dean Research PGI, Professor Kulhara, Professor Ajit Avasthi, Organizing Chairperson, Professor Basu and Professor Sandeep Grover, Organizing Secretary, Professor Srinivas Murthy, our one of the main guest faculty, invited faculty members from PGI, and friends. It is a great honor for me to welcome all of you to this National CME in Addiction Psychiatry, organized by Drug De-Addiction Treatment Center, Department of Psychiatry, PGI Chandigarh. I had pleasure of inaugurating a similar CME in Addiction Psychiatry in the month of April this year at PGI. The theme of that CME was medical complication of substance use disorders. What should a psychiatrist know? I understand that it was highly appreciated by the delegates, and this was held in Advanced Eye Center auditorium, where it was held that time cross its capacity. That's why this time we thought that this CME should be held in this lecture theatre number 1 here. Keeping this felt need in mind, I am happy to note that this national CME is titled as Medical Complication of the Substance Use Disorders. What else should the psychiatrist know? This sounds like a sequel to a movie which became a big hit. I am told that this time the registration are even much more than the last time, as it is evident because that time in the Advanced Eye Center maybe 110 people can come. And so here I can see the double the number of the participants today. And as already said by Professor Abasthi, that many of the people they have come, most of the people have come from all over the country, even from Telangana, from Andhra Pradesh, Andaman Nicobar, Lakshadweep and Sikkim, beside I think northern states. From the northern state we have Professor Dr. Rajiv Gupta, Dr. N.K. Sharma and several Dr. Dwarka Prasad, our old senior colleagues here present in the. It just go to show that this type of CME fill the felt need of professional working in the area of drug addiction, which is technically known as substance use disorder. It is common knowledge that the drug abuse is rampant in today's society all across the world, and India is not an exception. Northern India, especially Punjab, has been in attention of the public and the media for quite some time, and they have made movie also. I think I have not seen, but part of it, Udta Punjab or something, which is based on this drug de-addiction and drug addiction. And there are other states where there is a growing problem in the neighborhood. It is also Haryana, Himachal Pradesh, Jammu Kashmir. It is also very much there in all parts of the India, particularly the northern eastern state of states, and also in south, though the extent and pattern of the drug abuse varies from region to region. Substance use disorder cause not only mental and social harm, but also lot of medical harms. There are hundreds of medical complications of the substance use. Some of these are like HIV infection, hepatitis, COPD, heart disease, chronic pain disorder. They are the common in patients with substance use disorder. Hence, the psychiatrist working in the area of de-addiction must be well versed with at least the common medical complications of the substance use. This is especially important for an integrated care of the person suffering from the substance use disorders. Psychiatrists and psychiatric trainee need to have an update on the detection, differential diagnosis, basic investigation, and management principle in this area. And they should know when to refer the complicated cases to the specialist care. Therefore, I believe that this CME with the theme of medical complication of substance use disorders, what else should a psychiatrist know, is very important and relevant today. Drug de-addiction and treatment center of our institute has been working for this purpose under the drug de-addiction program of the Ministry of Health and Family Welfare since 1988. It has been providing services, education, consultancy and research in this area since then, and it has been recognized as the Center of Excellence by the Ministry of Health. It is also for the first time in the country to have started super specialty course of DM in addiction psychiatry. This also happens to be the 30th anniversary year of DDTC, and I must congratulate all the previous heads as well as faculty of the department of this department for carrying out this important service to the society. I am glad to know and glad to share with you that this year DDTC received the prestigious National Award for Outstanding and Exemplary Services in the field of prevention of alcoholism and drug abuse in the category of Best Research or Innovation. This award was conferred by none other than the President of India, Shri Ramnath Govind, to Professor Ajit Awasthi and Professor Debashish Basu. This is not only a great achievement for the Department of Psychiatry and DDTC, but also a matter of pride for the whole of the institute. I congratulate Professor Ajit Awasthi and his team for organizing this important national CME. I once again welcome you all to this Addiction Psychiatry National CME, and I wish all the success. Thank you very much.
Thank you very much, sir, for your most encouraging and kind words as always. I now request a memento to be presented to our chief guest, Professor Jagatram, please. Okay, at the end of this short program, I would now like to propose a vote of thanks. I sincerely extend my gratitude to Professor Jagatram, sir, who took out his valuable time out of his very busy schedule to grace this occasion and encourage us. I thank all the senior dignitaries, each one an esteemed teacher and clinician, and many of whom, as already said, are our departmental alumni themselves, to have accepted our invitation and taken the trouble to be here. I thank all the delegates and participants who have joined us in this academic program from near and far. Ultimately, it's your participation that makes this program meaningful and successful. I thank all the eminent speakers who have made every effort to make this activity a useful one. I thank all the chairpersons who do, especially our senior alumni and teachers, Professor P. Kulhara, Professor Srinivas Murthy, Professor Dwarka Prasad, Professor Sudhir Khandelwal, and others. Dr. Sudhir Khandelwal will join us later. I thank the Punjab Medical Council for accreditation of the CME with 4 credit hours. I must thank the lecture theatre staff for extending their help and support in every way, the engineering department, maintenance, photography, and all other administrative departments deserve a big thank you too. Finally, my task would remain incomplete if I fail to thank all my faculty colleagues, students, and staff of all categories of the department for their hard work and an excellent teamwork. This includes my faculty colleagues, other professional staff, office and secretarial staff, drivers, hospital attendants, and Safai Karamcharis. Dr. Awasthi, my teacher and my guru in more ways than one, deserves a special mention because of his dynamic leadership and vision. Last but not the least, I must thank the Drug De-Addiction Program of the Ministry of Health and Family Welfare for entirely funding this activity as part of its educational mandate of the Drug De-Addiction and Treatment Center. No external sponsorship has been taken for today's National CME. We have sincerely made our best efforts to make this activity a great learning experience for all of us. In case there is any shortcoming in any form, please pardon us. I request now all to please rise for the national anthem.
Punjab, Sindh, ब्रह्म उच्छल जल वितरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे।
Thank you. Please kindly join us for tea, and we shall resume the academic session at sharp 10:15 a.m. As you all know, PGI is a bit obsessional about timings. Thank you.